Hey Fusion family, here I am and I'm ready to do the cat stretch with you guys. I'm so happy that you guys decided to take some time out of your day to get your self-care on. We're all needing it right now. Everyone's self-care is going down the drain, so I'm glad that you guys have joined me today to get moving, take control of your bodies, and increase your range of motion. So I'm going to scoot back here on my mat so you guys can get a better view of me during the movement. So first of all, I want to tell you a little bit about who I am if you're new to Fusion or new to somatics. I'm Jennifer Duranzik. I'm the owner of Fusion Whole Body Recovery. We've been open for 6 years now, and I've been a body worker for 16 years, and I'm a somatic educator as well, so I bring somatics to the world. Just to tell you a little bit about what somatics is, it's a neuromuscular retraining process that actually reteaches bad habitual patterns that we hold in our bodies to let go and to give them full range of motion again, because 80% of pain that we deal with on a daily basis is actually functional. So this type of neuromuscular therapy is really beneficial because I tell people, I go, just like any repetitive movement that we do, our brain actually develops muscle memory because it's really smart and it wants to help us out. So that muscle memory is not always good. A lot of times it's caused by sitting at a desk, or it's caused by driving cars, or sleeping on one side chronically, or standing on one leg more often than the other. But you know, over time these bad habits can be created, and when we're at home right now sitting a lot and we're not moving our bodies and challenging it, unfortunately those habits become even more ingrained, and that's why you get so stiff or your pain level increases when we're not moving. So just to tell you a little bit about how to perform these movements that I'll be going through 8 of them. These are somatic movements, which we're retraining muscle memory. So focus is the key. So it's not about speed or how high you can go or how fast you can go. It's actually way better to go slower so your brain can actually process what's going on and retrain its full potential. So also know that this is your first class and you're learning to talk to your body again. So be gentle. You'll be exploring in this series the good, the bad, and the ugly of your body movement. So be gentle, don't go too hard. Your primary task in this class is to pay attention to what you feel on the inside. So really noticing when your body starts to shake or it's hit its end range of motion, and not necessarily trying to push past it, but acknowledging that it's there, gaining control in that area, and then moving on so your brain can relearn what it's supposed to be doing there. So we want to do these exercises on a mat, on the floor if possible, or a blanket. You don't want to be on a soft area. That doesn't give you enough feedback, so your brain doesn't have something to grasp onto. So try and get your mat ready. We always want to move slowly, so make sure you're going to be moving slowly. And these somatic exercises are not painful. So what happens when the brain feels pain, it actually stops learning, it stops making any progress. So again, lose the whole idea of the no pain, no gain. This is brain retraining, and it's a different process. So once your brain feels pain, it just goes pain, pain. It doesn't learn anything new. Don't force any movement, because again, this can cause pain. And then a lot of times what will happen is something called stretch reflex, which is when you get a cramp. So what happens is when you have a chronically tight muscle and you push past that tight muscle, your brain has actually forgotten full length. So let's say you have a really tight trap up here and you try and stretch it real quickly. Your brain's going to think that you're injuring it, so you will start to cramp, and it'll create stretch reflex. So definitely don't push past it. If you do start to feel that cramp, just go, I went a little too hard, I need to back off. Take your range of motion to right below that point and then move on. So we must first activate these tight areas. So when a muscle is stuck, contracted, or lost range of motion, whether it's your hips, your shoulders, your neck, your brain has forgotten what it's like to be fully relaxed. So what we need to do is actually contract that muscle more, because the muscle can contract more, it just can't release more. So we need to contract the muscle more and then slowly guide it out of a full release using the front part of our brain until we can reteach it how to let go. So I just wanted to explain that to you before we do the workout or the movements, because you're probably going to be wondering why I'm taking a tight muscle and making it tighter. There's a whole neurological process that we're trying to reconnect. We're trying to connect to those neurosensors to the muscle sensors. So we need to get them talking correctly. So that takes contraction, something that our muscle already knows, and then a gentle release. So another thing about these movements is be persistent, patient, and positive. We live in a quick fix society, and we see how that works for us. It doesn't give us long-term results. So these kind of movements are actually going to be permanent, but they're going to be slower, a slower process depending on how much muscle memory you have ingrained, or negative muscle memory ingrained. So what you want to do is take a different look at this as something that maybe you should be doing 3 times a week to help your body retrain how to let go of all the tension. And so the best way to do this class is I'm going to actually, you really want to listen to what I'm saying, not necessarily see what I'm demoing, because I'm going to be explaining to you through the process of what you should be feeling, and what that does is it makes your brain connect to areas of your body that you may have lost awareness of. So that is needed, because the big thing in somatics is if you don't know how you got there, then you don't know how to get out. So the stuff that I'm going to be showing you is going to show you how intricate a lot of these tension patterns are that we hold, and what all comes into play. And then if you do need to go ahead and take a break and look at me, make sure you're doing it okay, definitely do that. That's when I'm here doing it with you, but don't try and get to the height that I'm getting. Just listen to your body. So the way it's going to work is I'm going to go ahead and start with the movements. I will demo them once and kind of walk you through the setup for it. Then I'm going to sit back up. I'm going to go ahead and start talking, and then I'll go ahead and demo it a couple other times. But I want you to continue to do the movement until I tell you when to stop, and then move into the next movement. So the first movement we're going to be starting with is one that is all about the mid-body. So really the front and back of the body. So one thing I really like to tell my clients is that we have this concept that we're separate pieces, and that, if my neck hurts, my neck just needs work, or my arm, that just needs work, or I have a rotator cuff problem, oh, it's a shoulder problem. A lot of these problems originate from the core. And by that, to give you like an example, is if I have reach just through my arm, I'm keeping my core solid here, and I reach out like this, that's about my end range of motion. Now if I have a nice open mid area and back area, when I reach, I can reach longer. See, back and forth, back and forth. So many of the issues that we deal with really start from the core, from habitual tension, rolling forward, or arching back. A lot of you probably have the arches in the back. So we need to take control of the front body to start really making more progress in the outside of the body. So I'm going to start with the arch and flatten. You may have seen something similar to this, but again, remember it's cortical. So I'm going to lay on my back. You can lay on your back as well, or you can take a look at this before we get started, and then start when I tell you to. So we're going to lay on our back, and then our feet and our feet and our knees are hip width apart, and the arms are to the side. So this movement is to help regain control of the front body and the back body, and how we do that is contracting them back and forth, displacing the energy back and forth. So I'm just going to show the motion for you. I'm going to pretend like my hips are a rolling pin, and I'm actually going to take a deep breath in and start to arch my back. Pause in the middle, deep breath in. Okay, I'll do it one more time. Deep breath in. I'm going to arch my back. Deep breath in neutral. And exhale. And start my flatten. And I'm tucking my pubic bone up to my sternum. And then slowly relax. Okay, so I'm gonna have you guys do this about 5 to 10 times. You go at your pace. What I want you to do while you're doing this arch and flatten is really notice that when you arch the back, you're lengthening out the front body from pubic bone to sternum all the way up. You're engaging the full back. Everything in the back is engaging, and then as you exhale and slowly release, you're actually reteaching that back how to let go. So if you feel any jumpiness, go ahead and acknowledge it. Go, okay, brain, I'm gonna really focus on being smooth there, and then relax back to neutral. And then you always wanna take a deep breath in neutral. So you take a deep breath in, and on the exhale, you start to tuck the pubic bone. Also, I like to imagine that I become a C, and I'm tucking my pubic bone to meet my sternum. Now I'm engaging everything in my front body, saying, okay, if you wanna work, I'm gonna make you work. And then slowly release it out until it's completely relaxed. So go ahead and continue this a couple times, slow and controlled. Really feel not only the back arching when you arch the back into the arch, but your shoulders are pressing backwards. This is a whole back movement. And then as you exhale, everything's releasing. And when you take that deep breath in the neutral spine, you want to feel your belly rise up like a balloon, and then as you slowly exhale, use the exhalation of the flatten to tuck, 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 tuck even more. Now engaging the front body and lengthening the back and forth. So I'll go ahead and do this about 2 times while you guys go back and forth. If you guys have any questions over this, you can put this on the comments below. If you don't really know what you're doing, just try and do the best you can. The first time is always a learning experience. So. Okay, that's great. So now that we've opened up and lengthened some of the front and back, now we can move on and take it a little step farther. So if you're continuing to do these, go ahead and continue as I explain the next one, because it's very similar. You can just stay where you are and listen to what I'm saying. Now with the arch and flatten, the one thing that we're missing out on with the arch and flatten is that the rectus abdominis is actually all the way from the pubic bone to the sternum. And there's a last little motion that happens whenever we engage the abdominal muscles. So that's actually lifting up. So if I can have everyone go ahead and lay on their backs, we're gonna move to the next one if you're not already on your back. And we're gonna bring our hands behind our head clasped together. And the first thing I want you to do is when I tell you to, we're gonna all do this together as much as we can, being away from each other, social distancing. Okay, so what I want you to notice when we do this first is we're just going to keep our head on our hands and on the ground the first time, because I want you to feel what I'm trying to show you. Well, actually, let's go ahead and take the right hand and put it at the base of the sternum so you can see that extra engagement. So first, without lifting the head, I want you to go ahead and do an arch and flatten. So everyone take a deep breath in and slowly arch. And you can actually feel when you arch the back, the head gets heavy in the hand. Now, go ahead and take a deep breath in. And on the exhale, 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 tuck, 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 tuck. And you'll actually feel the head lift up off the hands because we're engaging the whole front body. Now, in flatten, you can go ahead and breathe in this position, but keep the flatten. Go ahead and put your hand back behind your head. And now I just want you to lift about 1 inch off the floor and bring your head up using abdominal muscles. So you can put the hand back there if you want to feel the engagement. That helps your brain understand what's going on. And I feel the top part of my rectus abdominis now engaging, and then I'm going to slowly relax. So we're going to continue this arch and curl a couple times. So I'll go ahead and show you a full arch and curl once, and then we'll go ahead and have you guys do it, and I'll check the comments and see if there's any questions that we can answer. So go ahead and take a deep breath in. Exhale out to a slow release of the arch. Deep breath in. Slow exhale, start to tuck that pelvis, flatten the back as much as possible on an exhale, and then lift up your head using the upper part of the abdominal muscles, and then slowly, gently ease off both of them simultaneously. So now we're getting full control of the abdominal muscles. So you guys go ahead and do this. And why this is so important is think about a rounded shoulder. Rounded shoulders are mainly caused by depressed chest and rounded shoulders. So the depressed chest and rounded shoulders is caused by the abdominal muscles being overly tightened. And think about what we do all the time. We sit at computers and we shorten our abdominal muscles. So my clients will come in, I hope you guys are continuing the arch and curl. My clients will come in and they will say, I have shoulder pain, my shoulders are rounded. You know, we could work those shoulders all day, but until, again, we release the mid-body, you're not gonna get full release. So I take this information, remember that whenever you're trying to open your shoulders. Remember, we gotta start from the core first, and the arch and curl and the arch and flatten are really great ways to do this. So we'll do this a couple more times. Really feel the engagement of the abdominal muscles. Don't pull on the neck, this is really important. Only come up about a half an inch, so your abdominal muscles are the ones doing the work, and then slowly ease off. Really feel that fluid motion of the full contraction of the back and the arch, the full, slow, and controlled, most important part, release of the back, and then pause in the middle, and then again, now moving into the abdominal muscles, contracting, 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 and then slowly releasing. You're releasing one side of the body while simultaneously fully contracting the other. So this whole process is reteaching your spine how to fully open and how to fully mobilize these two directions. Okay, so now we've got control of the front body. We've got control of the back. We're starting to feel a little bit more loose. You can maybe even put your hands on your belly and take a deep breath in. And notice that it feels a little bit easier, like your balloon's bigger. I always say we should all have six packs, but nice and squishy ones. So maybe your six pack's a little bit squishier now. So what we need to do now is get more control of our full back, because a lot of the back is what causes pain nowadays. And in this movement, again, one that you may have seen that's similar, you want to see, you want to notice that this is not just a low back, it's actually a full back contraction, which is including the traps, the lower traps, which are a little bit lower down here. And then we're gonna have some cross pattern work that we're gonna start working on with this one that helps you mobilize more when you're walking. So I'll show you this one. You're gonna lay on your stomach. I'll go ahead and have everyone face right first. Left arm's down towards the side, right arm's out. My hand, I like to put my thumb on my nose and then my index finger on my forehead, because we're gonna keep these glued at one point. And what I want you to do is, it's called the back lift, or it's similar to the Superman, is you're actually gonna lift up your upper body like this. I'm going a little fast right now to kind of show you the movements. And then the opposite leg. So straight leg up, slow and controlled. Now in my individual sessions, we break this down to feel each muscle contraction a little bit more. If this is hard on your neck, that's fine. You can take some breaks every once in a while and just put your head downward on your hands. But we're gonna go ahead and get started. I'm gonna demo this for you. So we're gonna contract our full back and then slowly release. So my foot is actually going to melt into the ground as well as my upper body. So I'll shift a little bit here. So deep inhale in. Okay, and I'm going to do this one more time to show you before I allow you guys to really go on your own. And I want you to notice my end. I don't thump down, I melt into the ground, because the last 10% is the most important part of control. That's where most habitual tension holds that can lead to stiff joints like stiff hips, stiff shoulders, E-TEC. So go ahead and start. Okay, so you guys go ahead and continue this. Everything's lifting simultaneously. Your head, your arm, your shoulder. You can take the eyes as you lift and gaze behind you like you're going to try and look at the opposite glute. So that left glute, don't turn the neck, just the eyes. And then slowly, gently release that upper body along with the leg. And what I want you to notice here is that the contraction, again, isn't just in one area. You have to contract the traps, the lower traps, the erector spinae, which is along the spine, the opposite glute. All of this is required in extension in this direction. So all of this is being used when we walk. So continue to do this a couple more times. And then when you're ready, we'll do that about 3 times. We're going to go ahead and switch to the other side. So go ahead and switch sides. I'm going to flip sides so you can see still. And I'm going to bring a couple more things to attention for you as I do this. So what I want you guys to focus on this time is I'm not going to focus as much on contraction. I'm actually going to think more, I'm going to bring my brain to the area of I need to open up my front body more to do this movement. So I'm going to think about lengthening up my front body and make my brain work in a different way. So okay, this time what I'm going to do is I'm going to really focus on bringing my shoulder back more to help with this engagement. Again, playing with our brain is the best way to retrain it. So I'm going to think about all the things that need to happen in order for me to make this lift. So now I'm going to focus on my shoulder a little bit. Okay, so you continue to do the same. Really feel the glute engage when you lift that opposite leg up as well. Notice when you lift the leg up higher, the spine engages more. Notice that when the leg lifts, or the leg lift ends and it melts into the ground, you can actually feel that glute melting like melted ice cream. That is, we all will say, you know, my butt is so tight. I hear that all the time. It causes tension and loss of range of motion in the hips, which can then cause issues like arthritis and needing to need joint replacements. So really take control of it. Feel that engagement in the glute and then feel the full relaxation of the glute. So I'll give you a little bit more time. Again, if your neck bothers you, take your neck out of it. You can even bring your head down and place it on your hands and then just do a little tiny head lift whenever you do the back lift. That's okay. You know, we all have different starting points. Some of us are a lot tighter than others. Okay, so now, you know, we've worked our extensors, we've got more range of motion, we've opened the front and the back. Now there's a very, very chronic issue where people will have one side that's longer than the other. Sometimes your chiropractor, your physical therapist, your massage therapist may say, yeah, you have one leg higher than the other. Most of the time, unless you're genetically born with a shortened femur, it is caused from tension in the obliques. So I'm going to show you an oblique move called the side curl that will, you know, it really did change my life. It helped me open up after a issue with discs, because I'll tell you, between the front and the back and the sides, this is how disc problems occur, bulges, herniations. Imagine if you have one side of the hips that's chronically tight. What is going to happen to the disc? Well, that side of the spine is going to cinch down, causing a bulge on the opposite side of the spine. And if that bulge gets fat enough, you have a slip and fall, something that causes an extra trauma, that thing can bust and you can herniate. So a lot of times people will have symptoms on one side, but it's actually caused by the chronically tight side on the other side that cinched down the spine and caused the bulge to happen in the first place. So I'm going to show you how to do that. So people that are watching that have bulge issues or herniation issues, be careful, be cognitive, be focused, but this can actually really change your life. For me personally, it has. I'm a victim of the herniation and in my early 20s, and this thing has really changed my life as far as pain. So I'll go ahead and show you this movement. You're going to lay on your side. First, what I want you to do is you're going to place your hand on your hip right above your iliac crest here. You're going to bring your knees up towards 90 degrees like you're seated in a chair. You're going to bring your feet below your knees at 90 degrees. And I want you to really imagine you're seated in a straight back chair. Don't be curling forward like this. Don't be swaying back. Imagine you're making hard 90-degree lines with your body. Now there's two obliques. They're external and internal oblique. The external oblique does one thing, the internal oblique does another. They both contribute into elevated hips. So I'm gonna have, let's do this here. Okay, so the bottom hand's on the oblique. So what you're gonna do is I want you to imagine between your hip and your rib cage is an accordion, and we're gonna cinch that accordion together using my oblique. So I'm not gonna pull on my head like this. I'm gonna use my oblique to lift myself up into a little side crunch. So again, check your posture here. And bring your shoulder back, the bottom one. And I'm gonna go ahead and lift and imagine bringing those two together. My armpits going over my hip in my mind, and then slowly releasing. And go ahead and place your hand on that side body there. As you lift up again, feel the engagement so your brain can really understand what happens with this lifted hip. We need to know how we got there in order to get out. So teach your brain that a tight oblique lifts the hip, and then slowly release it. And then we'll do that one more time, feeling the engagement of the external oblique, and then slowly release it. Okay, now moving into the internal oblique, we're gonna put our hand a little bit inside the hip flexor area here, and I want you to keep your knees together, but you're gonna lift the top foot off the bottom foot. So go ahead and lift. You're going to feel little engagement right in that area, and then slowly release it. And you'll also notice if you put your thumb on top of the iliac crest, your hip lifts a little bit when you do that. So again, something that causes a pretty significant hip lift if that oblique is tight. Okay, so now we're going to combine the two moves together to fully release the side. I really love this one because I'm going to show you guys how much of a difference it can make. So let's do this 5 times. I'm going to give us about a minute to do it. No, let's do it 3 times for a minute. So about 20 seconds apiece. So slowly combine the two. Lift the top foot off the bottom foot. Bring that rib cage towards the hip. And now slowly, very gently, open that accordion up. Open up the space between the rib cage and the hip. And I'm going to let my body sink and release. Okay, we'll do that 2 more times. Slowly lift, engage that internal oblique, engage the external oblique. Say, hey, this is what a full contraction is, body. Now I'm going to show you what a full, slow, controlled release this is. Okay, let it melt, and then we'll do 1 more time. Lift the foot up, draw the armpit over the hip here, and then slowly, gently ease off, and then let it melt down. Okay, now go ahead and lay on your back. You're going to bring your feet together, and you'll notice if you did this right and slow, your right leg's going to be longer than the left leg, or if you did the left side first, the left leg is. So you did that. That's amazing. You did that. You reteached your body how to open up. So go ahead and switch to the other side so we're not walking around with one hip higher than the other. Now, so we're going to again go to the side, switch sides. You can place that bottom hand on the oblique. It's going to do nothing but good to show your brain exactly what happens. Bring the hand over the head, grab the opposite ear, and then slowly, gently lift the upper body and the top foot up simultaneously. One side may be harder than the other. That's really common because we're contralateral movers, so we tend to have
issues, we tend to have a dominant side, so that would make sense. You know, some areas of our body are a little bit more difficult to control because they have more habitual tension in there. Okay, I'm going to do this about 3 more times. If you're going slower, that's fine. Slower is always better if you need that to control and open up fully. Let that top foot melt into the other foot, and then we'll do 2 more. And then melt, and then let's do 1 more. Feel the contraction, imagine those ribs and hips coming together. Now slowly imagine it opening up like that accordion, making a nice curved shape, and relax. So another thing that you can try next time when you do this at home is that I want you to imagine that the opposite side, so the side on the floor is the one that's actually lengthening. So you can again bring your brain to that area to teach it exactly, okay, if I'm gonna do this move, I also need to have an open right side and a tight left side to do that move, so you can bring the brain to a different area. So when you do this again at home, you can do that. Okay, so now we've done the side curl. Now what is one of my very favorite ones is called the washcloth. We've got 3 more movements. The washcloth is relaxing. If you're a client of mine, you've done it before and you probably love it. We're gonna show our body how to rotate, and we're gonna lengthen our spine. Anytime that you do a twisting motion with an item, it is physically impossible for it to shorten. It has to lengthen. So we're about to do that with our whole spine. So you're gonna lay on your back. You're going to bring your arms out like a T, feet and knees together. We're gonna start this step by step because this one is complicated. It's kind of like patting your head and rubbing your stomach. So first what I want you to do is I want you to flip your right hand downward, roll your shoulder forward, and then flip your left palm up, and then roll your shoulder back. Okay? Now slowly change positions. As the palm on the left goes down, the shoulder rolls forward, and as the palm on the right goes up, the shoulder goes backward. And we're just gonna feel this twisting motion. My neck actually already popped because of this, so that's great. So I'm creating a washcloth in between my shoulder blades right now. So I'm adding length to my arm length. I'm taking tension out of my shoulders. I'm taking tension out of my elbows. And because I'm doing that, I'm taking tension out of my neck. Okay, and then go ahead and do 1 more of the turns, and then stop, and then rotate your head towards the palm up. Now I'm staring at my palm up. Now I'm going to simultaneously rotate my shoulders as I turn my head at the same time. Okay, now we're going to start getting complicated. So my brain has to really focus on being as simultaneous as possible, and I can relearn. Oops, see, I didn't go all the way. Well, I cheated. Okay, now go the opposite direction. Now I'm adding a washcloth in between the shoulder blades and the neck. So now there's like a cross pattern going on. I'm adding length to my neck. I'm adding length to my shoulders. I'm adding length to my arms. Okay, 1 more, and then I want you to pause with your palm up and your head facing that palm up. Now the rule of thumb is the nose hates the knees, so now we're gonna add some more hips and back. So I'm gonna let my knees drop comfortably. See, I'm not gonna force them, I'm not gonna press it down. I'm gonna stop wherever my knees stop naturally, and I'm gonna simultaneously now rotate the arms and shoulders, and I'm going to turn my head, and I'm gonna bring my knees to the opposite direction. So this takes some concentration, so I'm gonna go ahead and just do it and let you guys do it, or watch if you need to get the motion. Okay, now I'm going to really focus on using my back and hips to lift my knees up and pull them to the opposite direction as I rotate my head and roll my shoulders. So now that washcloth is in between my shoulder blades, neck, mid-spine, and I'm doing some hip release. So I just want you guys to go back and forth. It's easy and lazy. Really feeling the body lengthen. focusing on what it takes to lift those knees, focusing on what it takes to roll the shoulders back, use those external, those back muscles to roll the shoulders back, use the pec muscles to roll the shoulder forward. Feel the body, how it moves, and you should start to notice that it gets easier. Your body actually moves more freely, and it drops easier from side to side. Okay, we'll do one more towards one direction. I'm actually pretty impressed that I'm able to do this. Now, I'm not getting as much benefit as you are at home because I'm having to talk, but it's better than nothing for sure. I'm gonna feel way better. Okay, so now that was our washcloth, we've opened up. Again, something that we like to do is move internally and then move outward, because if this is tight, everything else is. So now we can actually start moving into a little bit of hip work called inversion, eversion. So inversion is when your legs roll inward, eversion's when they roll out. So we need mobility both ways. Now I will tell you, this is a big one to notice. Whatever side is your easy, or whatever direction is the easiest to do for you, means that is chronically tight. So if my external hips or my glutes are really tight, it's gonna be way easy for me to draw my legs out because they're already tight. They're like, hey, we can do this. This is super easy. Then you'll notice when you try and roll them in that it's hard because those external rotators are tight. They're restricting you from internally rotating. So this one's real fun to play with and kind of feel those differences. So I'm going to do the easy version for you. There's a couple versions of this that in individual classes or in other videos that I'll have that I can show you some more complicated fun versions. So all you're going to do is lay on your back, and it's super simple. You're going to start with the left or right, whichever you prefer. And let's just go ahead and start with the eversion first. So it's just, we're going to rotate the foot out and then slowly bring it back to neutral. And what I want you to notice is if you even want to place your hand out here, what rotates your foot out? It's your glutes. And then slowly release the glutes. So we're going to do that 3 times. One more time, externally rotate that foot. I don't know if you can see. There we go. Externally rotate, so this direction. Externally rotate the foot and then bring it in and relax. Now we're going to internally rotate the foot. So I want you to imagine that the femur is the one rotating. So you're rolling the femur head inward like this, inward. So I'm going to roll my femur head inward. Oh yeah, you can feel that tension on the outside hip. That's because I'm an external rotator, or a what we call a green light. I can do a video about all the postures and which one you are, and then slowly release. Maybe I'll do that next week. Okay, then internally rotate. What is going on when you do this? You're probably feeling a lot of tension on the outside hip, but what's drawing you in? Your internal rotators, which are your adductors. Little bit of your pelvic floor is also doing this. The pelvic floor would be, you can continue to do this as I talk, but the pelvic floor would also be engaged if you were lifting the foot up towards the pelvis as you were internally rotating. Okay, it's getting a little bit easier as you do it. Okay. Go ahead and finish your last one, and let's flip to the other side. So switch to the other side. So whatever foot you started on, move to the other one. And we're going to start with some external rotations of that femur head. So externally rotate, feel that glute engaged. Now slowly disengage that glute, controlling it, making it as smooth as possible. Back to neutral. And slowly roll out. Another way you can tell if you're chronically tight in your hips is if you have duck feet, or if you're laying on the ground right now and your feet are flopping outward. And then slowly, gently ease off. Pigeon toes are a product of internal tension and habitually held patterns. Okay, we'll do one more. And then slowly release. Okay, now let's switch to internal rotators. So imagine that femur head rolling inward. Engage those adductors, those inner thigh muscles, and then slowly, gently ease off. And then do that again. And slowly, gently ease off. Kind of talking about these inner and outer muscles. as you guys continue to do this. I went to Palo Duro this past couple months ago, and it was really fascinating because I went on a trail ride, and I had one of our instructors. She said she instructs, she does these trail rides every day, several times a day. It's what she does. And then just kind of on a different subject, she was talking about how she was skiing, but she couldn't ski because she constantly cramped. She said my inner thighs cramp, everything cramps, and I told her, I said, you do realize that's because all day, you guys can continue, you can go ahead and sit up, all day you ride horses. So as soon as you go into a movement where you need to open your legs and you need to make different strides, you get something called stretch reflex that happens. I think I might have lost her a little bit. That's the time when I'm like, okay, Jen, it's not worth the time, but I hope that people look up the website and reach out to me. But it's just really fascinating that these issues that we deal with on a daily basis, we think, oh, I can't do these activities. And I'm like, no, you totally can. We just have to figure out how to release those habitual patterns that you're developing every day by your job or your sport or whatever you're doing throughout the day. Okay, so got that inversion, eversion taken care of. Now the last one, we're going to do a little bit of neck. The neck is probably already improved for you because we've already released the front body and created some movement in the neck. Like mine's feeling pretty good, a little tight at the top, so this one might help. This one can be a little complicated in the seated position, so you can either sit with your legs crossed. You're not going to feel as much benefit, but that's okay. Again, we just all start somewhere. Or you can do the full movement, which is I'm about to show you. So what I want you to do is you're going to place your left hand on the floor. You're going to bring your knees out like this. Yeah, this is where we get complicated for some people. So you have to have a little bit of open hips. So your hands on the floor, your knees are facing left. Your right hand's going to go on your shoulder, and I'm going to have you go ahead and rotate yourself all the way towards the left. So you're going to feel a little tension here. Now again, if it's cramping, don't go so hard. And keeping your head still, I want you to take your body and slowly rotate the trunk 3 times to the right. And then on the last one, whenever you go back towards the left, really rotate towards the left, hold it there. Now take the head and rotate it towards the right, and then back. Looking over that right shoulder. Okay, on the last one, what I want you to do is go ahead and turn. Let's everyone turn towards the right. Keep our heads there. So our trunk is going left, our head is going right. And now, simultaneously, go opposite directions. Ooh, got an upper cervical spontaneous realignment. If you hear, I have a slight bit of grinding in my neck, that tells me I have something called crepitus, which is just a little bit of cartilage and bone rubbing together. So again, taking that information, and now I know that I need to do some more somatic movements specifically for that after I do these. Okay, now go ahead and switch sides. If you're in the cross-legged position, you can stay where you're at. Just follow along the rest of the way. So go ahead and put your left hand on your right shoulder, switch the knees facing right. I'm going to rotate right, and now I'm going to slowly keep my head straight, following my trunk towards the left. You can put your hand back down, that right hand down to add stability. I'm noticing a little bit, I can tell that if I was to rotate too much, I'd get a stretch reflex, so I'm just going right before that. And I can definitely tell that I'm chronically tighter on this left side. Okay, now go ahead and rotate all the way to the right and rotate the head back and forth, keeping the trunk still. . Do as much range of motion as possible without creating pain or discomfort. I like to try and track my eyes on the same line across. When we do the neck class, the neck and shoulder class, we get to utilize the walls a lot more to gain range of motion. So, okay, great. So on the last one, let's go ahead and pause, turning left. And now the trunk is facing right, your head is turning left, and we're going to simultaneously switch positions. Again, this is fun, like you notice, wow, I am not ambidextrous. My brain, no wonder I have issues in my body when my brain doesn't know how to move one side as well as the other. Okay, we'll do that 2 more times, simultaneously twisting the spine and the head. Okay, and then when you're all done, go ahead and relax. You can lay on your back or you can stay seated. And I want you, you know what, let's go ahead and all just lay on our back because I want you to feel your body. So you can lay flat out, bring your arms up, your palms up, legs out, and then just take a couple big, deep belly breaths. Breathe through the diaphragm like we're supposed to. So breathe. Absorb the new movement. Fill your body and your mid-body with air. A true deep breath. You should feel all the way up into the chest and all the way into the pubic area. And you guys continue to do this. And what I want you to notice is, do you feel more alive? Do you feel like my body feels like it's vibrating, or it feels like, warmth to it? What that is, and I always say I'm a holistic hippie because I am science, I'm all science. What that is your neurons in your brain are now connected to your body, probably more than it's been in a very long time. So that alive feeling is actually that communication. The muscles, the brain telling the muscles to respond, or telling the muscle to do something, the muscle saying, I did that, and then the brain acknowledging it. We've just taught to all different areas of our body and created more mobility. So just a couple of things to be aware of. This 8 movement class is actually meant to be after Myth of Aging, which is an 8-class series that I teach that open up these areas of the body specifically for about 30 minutes to an hour. So if you had difficulty with this, just remember that, it's a starting point. Especially that last one is a little bit difficult. I will be having more classes. I do them at the Grapevine Rec too or at every 3 months, quarterly. So I have those. And you may be a little bit sore after this session and the sessions that you will be doing at home because you are creating more range of motion. Your brain and your body are now opening up. So we always say, oh, this area is weak. It's not weak, you just lose control. So now that you're gaining control, you might have a little soreness that's just similar to workout soreness. Now, if you're in pain, you went too hard, it happened, especially after the first one. So just take that information again and put it in your pocket and go, okay, next time I'm not gonna go so hard. What you wanna do is you wanna try and make this a 3 times a week practice. And because what this allows your body to do, I call it the cat stretch, because every time a cat gets up, I didn't call it that, Thomas Hanna called it the cat stretch, because every time a cat gets up, it manipulates its body, it pandiculates. It's something called pandiculating. So you're actually pandiculating your body out and regaining control out of the bad habits that you've had all week through work, all day, or all night in bed, and so on and so forth. So 3 times a week is a good practice to have. Your body will definitely thank you. And I do want to let you know that I have the audio of this available for purchase. It's only $10, but it's the 30-minute class where I do more talking and explaining what you should be feeling. That if you want to just
put that on your phone, do it 3 times a week, I do have that available. It's only $10, and you can Venmo me or Zelle me. I'll put the information on how to do that in the comments below. So you can do that if you're interested in the audio. I'm still kind of new to this Facebook Live, so I'm going to try and save it so I can put it on YouTube as well. I'm pretty sure I can do that, but if not, I'll just re-record it and put it on YouTube. And let's see. Oh, and then I have another class coming up. So Breathing with a Purpose was originally supposed to be a live class that was $30 on this coming Sunday. So what Tarka Sullivan and I have decided, Tarka is a yoga instructor, is that we're going to make it another experience like this. So Breathing with a Purpose is going to be teaching you how to open up the diaphragm more, how to increase the depth of your breathing, how to open up your back. What this is going to do is dramatically decrease anxiety and depression, which unfortunately a lot of us have right now with the stressful situations that we're going through. It's also going to lower your blood pressure, improve sleep, and have endless benefits in your health. So I'm going to be doing that at 1 p.m. live again on Saturday. So I'll be posting about that. And then I will be then putting a link on my site for Tarka's portion, which Tarka will be walking you through some breathing practices that will utilize that new space that you can do all the time to improve your health. So also I want to let you know that I have the Somatics Reawakening Your Mind's Control of the Body books by Thomas Hanna. It is a very, very great book. It goes through the science of why this works so well as some picture diagrams of the movements in the back, and some case studies that have shown that this stuff really works. So if you're interested in that, that's $20 as well, and I can ship that to you, with Amazon being a little bit odd with the ability to ship certain items. I can do that for you. So if you have any questions, concerns, or you just want more information, go ahead and comment below and I'll get back to you. I'll put that information, and as well, I do want to send you guys the written version of the cat stretch. So if you can share, message me your email, I'd appreciate that. You can just message the Fusion site. I'll go ahead and send you that, and it's the actual written out details that you can print out at home and have. So I hope you guys enjoyed the class. I will see you guys hopefully all Saturday, and please let me know if you need anything. And I've appreciated you spending this time with me, and I will talk to you later. Bye.